Hi everyone, our presentation is on the Sentence Production Program for Aphasia, also known as the SPPA. The presenters are Camila, Natasha, and Gabby. So what is the SPPA? It's an assessment with 8 different sentence types with 2 levels of difficulty, and each sentence type contains 15 items. So these sentences are presented together with a picture and introduced with a context read out by the clinician. So the picture's on one side of the stimulus book and the prompts are on the other. The 8 types of grammatical structure have different levels of complexity that you progress through as you take the assessment. And the SPPA helps people with aphasia to form sentences. The authors of the SPPA are Nancy Helm Estabrooks and Marjorie Nicholas, which are the creators of the HELPS, which is the Helm Elicited Language Program for Syntax Stimulation. So this was an original assessment that they created by them that is very similar to the SPPA that has now been advanced into what is now known as the SPPA. The HELPS program also utilized a stimulus book and contained multiple sentence types for the clients to hear using different probes to test their knowledge. The purpose of this assessment is that the sentences in the SPPA use different words and have different meanings, so it's applicable to many different settings. In the treatment, the SLP reads stories to the person with aphasia, and the story contains examples of sentences that are the targets of the therapy. The individual with aphasia will first try to repeat the sentence. If they're able to repeat the sentence, the SLP will then ask a question to get them to say it on their own. The goal is to help individuals with aphasia form more complex sentences independently.
The sentence production program for aphasia is appropriate for individuals who have agrammatism or a difficulty with sentence structure and syntax. Agrammatism is most common in non-fluent aphasia, such as Broca's aphasia. The person with aphasia needs to have basic comprehension abilities, attention, and memory. The treatment requires that the person understand the stories that are read to them and remember some information. The materials used include the administration manual as well as the stimulus book. The patient is presented a brief story with a picture. The goal is to elicit target phrases from the patient using first delayed repetition, level A, and then without benefit of repetition, which is level B. Once the patient has mastered 15 examples in each of 8 sentence types, the patient moves on to the next sentence type. Here are the 8 sentence types that are presented in the level of difficulty. Imperative intransitive, imperative transitive, WH interrogative, what and who, WH interrogative, where and when, declarative transitive, declarative intransitive, comparative, and finally, yes or no questions. It is recommended that sessions take place about 5 times a week for 30 minutes each. Each session will increase in syntactic complexity. At this rate, it will take about a total of 4 sessions to complete each sentence type for a total of 32 sessions.
So for the outcome measures, there are a few ways that we measure improvement. The client will progress through the sentence types as they achieve them. The more sentence types that they have achieved, the higher the accuracy of the sentence construction. A statistical analysis is performed on the accuracy and familiarity of the sentences compared to the answers. Pre-treatment, mid-treatment, and post-treatment scores are recorded and compared. Researchers also use the Kruskal-Wallis test, followed by Tukey's multiple comparisons test to check where the differences occurred. The protocol for SPPA is as follows. First, the sentence type is presented is imperative intransitive. The clinician tells the client that she's going to tell him or her about a series of families. She reads the prompt on the stimulus book, which briefly describes the families to the client. So an example of this prompt would be, Nick's school bus arrives in 15 minutes and he's still asleep. His mother tells him, wake up. And the clinician will ask, what did his mother say? prompting the client to answer, "Wake up." So overall, the participants are shown a series of pictures, and the probe is on the other side of the book in view of the clinician. If the client gets the level A probe and the level B probe correctly, the clinician will move on to the next item. If the client responds to the A probe incorrectly, the clinician skips the B probe and moves on to the next test item. So the next prompts will have all the same sentence structures of imperative, intransitive, and so on. So the clinician will go back and do all of the probe questions for probe levels A and B, and the client will have to remember the correct responses for each item. Once the client has reached the performance criterion of 13 out of 15 for probe level B alone, the clinician will move on to the next sentence type. This method is repeated for all the sentence types. And the last and most complex type will be for the client to formulate their own yes or no questions. Formulating yes or no questions is the most difficult complexity. They have to come up with their own questions related to the context of the picture. And what do you think of the treatment? Is it easy or hard to learn? We believe that the treatment is very easy to learn and understand. It is also pretty easy and straightforward in terms of administration. Another benefit to this treatment is that you could provide the caregiver with the sentences that the patient has produced correctly during the session and have them practice those same sentences at home. The therapy should be done around 5 times a week for 30 minutes. We believe that the SPPA can generalize very well to different sentence types. It can also assist the patient with their discourse skills, and that it can generalize well in contexts that align with specific stimulus items. So stimulus items that can apply to real life situations can help because it can elicit full sentences from the patient that they can use in real life. Something that we didn't like about the treatment is that it is only useful for individuals with a non-fluent aphasia like Broca's. Something we liked about the treatment is that all of the different types of questions and sentence types. The sentences also get harder as the program progresses. If we had to change the treatment, we would make it available for a larger population and not just individuals with agrammatism or Broca's aphasia. And here are our references.